My name is Jacob, and this is going to be my female indwelling Foley catheter with abdominal assessment. So the first thing I'm going to do is I'm going to check my patient's chart, know that I have a need to do a Foley catheterization on my patient. Upon looking at that chart, I'm also going to check and note for any allergies at this time. So I know what I need to do for the procedure. I'll go ahead and gather my supplies. I'm going to check my supplies for the expiration date, make sure the integrity of the packaging is good and that everything's intact, and gather all my supplies and an extra pair of sterile gloves just in case. And then I'm going to go to my patient's room. I'm going to knock in the room once I gain entry. I'm going to say, hello, my name is Jacob. I'm a student nurse with Madison College. If you can state your full name and date of birth for me. And I'm also going to check the patient's ID marker so I know who I'm dealing with. I'm also going to ask her at this time if she has any allergies, just confirm that with the chart. There's no known allergies, so then I'm going to provide for privacy. Good hand hygiene again, if I haven't already done that. And then I'm going to explain the procedure, saying that I'm going to do an abdominal assessment. I'm going to make sure we have the need for a Foley catheterization. So once I do my abdominal assessment, and then we'll go ahead with the Foley catheterization. I would ask her that it is let her know that it is an uncomfortable procedure, and that let her know what to expect. But she will feel a lot better after the catheterization. So then after that, I'm going to do an abdominal assessment. So I'm going to be providing for privacy, trying to be modest. Okay. So for the sake of this video, this doesn't exist. The nasogastric tube is not in place, so that's why it is a level bed. So there's nothing else wrong with it. Okay. So then next I need to elevate her legs a little bit. So I'm just going to sneak a pillow in there so then her abdominal muscles will be relaxed. So then the assessment will go a lot easier. So once that's done, so now I'm going to make sure I have a clean stethoscope before I begin.
I'm not going to clean one cotton ball at a time.
It's good. Get all that.
Wiping one and done, front to back.
Okay. So then with the abdominal assessment, I'm going to be doing first inspection. I'm going to look at the abdomen. I'm going to look for any kind of distension. Obviously, I'm going to notice that there's distension over the bladder area. I'm going to note the umbilicus, whether it's midline. I'm also going to see if there's any kind of masses, lesions, note the color of the skin, and just the general all-over assessment of it. Even I would notice contour, so maybe get down here and notice the contour of it. And then after all that, I would go ahead with auscultation. With auscultation, I would listen for each quadrant for 15 seconds, and listening for bowel sounds. And if they were hypo or non-existent, I would listen to each quadrant for at least a full minute or 5 minutes total. So I'm noting bowel sounds every 15 seconds in each quadrant again. Okay. All right. Then I would flip it over to the bell, and I would listen to the descending aorta. Notice for any signs of bruit, any kind of swishing sound. I'd also want to do this on the iliac and the femoral arteries. Okay. And there's no bruit sounds that I'm hearing right now, so I'd make sure I don't want to listen for that. So that is auscultation. After that, I would be doing a light percussion. And I would also want to ask the patient if there's any kind of tenderness along the abdomen. So then once there is none that she's explaining to me, I would do a gentle percussion, listening for tympany or any kind of dullness associated with each quadrant. So that's good. And then the last thing I do is palpation. So when I palpate, I want to also again notice that if there's any kind of guarding or anything of that nature, and I would kind of do it in the lower right quadrant, moving around. Notice I can see if I can find any kind of masses that were unseen. Just light palpation. So there's nothing there. It looks good. The bladder is still distended. So then we would go ahead with the catheterization. So this pillow. Okay. So then I would okay. So at this time I would do some pericare, and I would also do the pericare front to back, clean and dirty, and I would also try to note the location of the meatus to help me out with the insert of the Foley catheter. So then after I did pericare, then I would go ahead, some more hand hygiene after all that.
and I would document everything that I did on the other.
So now I'm ready for the Foley catheterization. Make sure my table's in the right way, so do it this way. Okay. I'm just going to move this here. Next pair of gloves, just in case. And see the table? There we go. So then, my package, expiration date's good. Integrity is good. Open it. There we go. This is going to be my makeshift garbage. Okay. That there. Alright. Alright, now I want to open my package away from me. Okay, I'm going to touch the outer edge and rotate. Alright, there we go. And then I'm going to grab my sterile drape, touching the 1 inch. Shake that out. Now the shiny sign is going to go down. So then I'm going to gently lay this in between the patient's leg. Need a little more space here. So then I'm going to ask the patient to kind of assist me and lift up the buttocks and grab and move the sterile field a little bit closer. Alright, so that's good. Now I'd also instruct the patient to try not to move the legs at all so that they don't contaminate my sterile field, and then I can not have to do this again. So the next thing I'm going to do is I'm going to take my gloves out. Alright, and then I'm going to put on my gloves. So I'm just going to stand here on the side. Right here.
You can use that size?
Yeah, I can use the size. I'm actually going to rotate my table a little bit so you can better see this. I'll just have to manipulate this with my foot thereafter so you can see my sterile technique. So I'm just going to go underneath here. Okay, tent. Alright, opposite hand. Here we go. These things are a little smashed. Alright, here we go. Get that sucker on there, and then I'm going to do the 2 fingers. Go underneath the cuff. That cuff. And then, alright, let's switch the hand around. Here we go. And pull this sucker on. Okay, good. So now that I have my sterile field and my sterile gloves, so I need to manipulate my stuff in here. So then I'm going to take out this. I'm going to set this on my sterile field, so that's sterile. I'm going to take out my specimen container. Do not need this for this video. I'm not going to collect a specimen, so I'm going to set that aside. I'm going to pick up my box and put it near the edge, but not contamination edge. Alright. I'm going to take out my tray. Do that, so then it's all contained. Can you see that?
Yep.
Okay. This is where I want to, let's just go in here and dig in the bottom and make sure that it's clamped. Okay, it's clamped, there we go. So I need to take this thing out. So then I'm just going to slowly do that. Okay, there we go. It's going to be dropped right there. Alright, next thing I'm going to do is I'm going to dig around here. I'm going to take off my cap. This is my water. And I'm going to insert it into my port for the balloon, for the Foley balloon. Let's stick that in there. Okay, that's good. And then I'm going to open up my iodine. Actually, I'm not going to open that quite yet, because I need to fluff my cotton balls. So I'm going to fluff. This is still sterile. This is not open. Fluff, 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 fluff. So they're all fluffed. There we go. Open. I'm going to pour that over there. Okay, so that's done. Drop that. I still have my syringe here with my lubricant. Okay. I would then squirt this in this little container that is provided right there. So that's done. There we go. And now I have both my trays set up. So this is both sterile. So then I would put that back on top of the tray really quick. And then I'm going to move my box, which is still sterile, onto my sterile field.
I'm a rusher.
Noting the 1 inch edge.
Not like purposely doing this.
Okay. Take this, put that right there. So then everything is in my sterile field. I'm going to move my table a little bit so I can better work.
Once I get it in.
Now once I have everything, I need to find my catheter. I'm going to lubricate the 2 inches on the tip there. All right, and I'm just gonna kind of set that in there. That should stay because it is stuck. Okay, now that I have my iodine, my balls, my cotton balls, I'm gonna use my forceps. So then this is gonna be my clean hand, and this is my sterile hand. I'm then going to use this to clean the labia. Thank you, assistant with a pen light. So I got my thing. I'm gonna start out at the labia, go 1, and then done. I'm gonna use up all my cotton balls, going from the top down, front to back, and go right down to direct of the meatus. And also try to relocate that from the pericare. Just make sure you get it really good and clean, and then go straight down. Okay, and that's all done. Now this is where I really need to be considerate, and my helpful assistant with a pen light. I'm going to take the first little part, and I'm going to insert it without touching anything else right into the meatus. I'm going to insert it about 2 inches, because that is probably about the urethra. And then once I do, I should get some urine, which I have, and then I'm going to insert it about another inch or 2 to make sure that it is well inside the bladder. After that, I'm going to kind of stabilize it. I'm going to, with my still sterile hand, I'm going to inject the amount into, and then I would also note if there's any pain for my patient, I would stop immediately, and then I would advance the catheter another inch at least to make sure it is in the bladder. So then once the balloon is then inserted, I will then do a gentle tug, and notice that it is inserted there properly. So then I need to remove my thing. So I'm going to touch the barrel, unclamp this, dispose of that, and then, so then it is properly inserted. I noted that. I'm then going to remove my gloves. Okay. Let's go into my bag. And hygiene. So now I need to apply the leg strap. So I have my leg strap here. Going to gently raise the leg. Okay. Put this around. And then I'm going to take my Foley catheter. Make sure there's a little bit of slack here so that it's not tugging, causing my patient any pain. Okay. Make sure that's there. So that's good. There's some slack right there. Okay. And then I'm going to attach the bag over the leg. That would be these little wings out. Okay, make sure there's no kinks. And then I'm going to attach it to the side of the bed here. Okay. And it's unclamped and it's ready to go. All right. There we go. I'm going to do some more hand hygiene. All right, and I'm going to see how well the patient tolerated the procedure. I'm going to clean up my mess. Okay. And then I'm also going to see how the patient tolerated it. I'm going to document the size of the catheter. I'm also going to reposition her, make sure that she's comfortable. Notice that the Foley catheter is running, and make sure that she has relief from her distended bladder. I would document everything, the time, catheter, and make sure that she was comfortable. And if there's anything else that I can get her at this time, I would make sure the call light is well within reach so she can call me at any time. Make sure the side rails are back up. And I would clean up all of my equipment. Okay. And I'm going to put the bed in the lowest possible position. I'm going to re-sterilize my stethoscope because I use them, so I don't use them on the next patient. Clean up my supplies and document, and then come back in a lot amount of time to make sure my patient is well okay, and the catheterization has worked. And that's my video.